Welcome to Ames Responds to COVID-19. This is a question and answer program where Ames area organizations respond to your COVID-19 questions. I'm Susan Guiasa, the Public Relations Officer for the City of Ames. We have several questions that have come in this week, and we have several guests on our panel that are here to respond. If you have a COVID-19 question, please email us at covid19@cityofames.org or call us on our special COVID-19 hotline. That's 515-239-5670. We will try to get to your question on our next show. So let's go right ahead to our panel and let's get some questions answered. Our first question goes to Kathy Johnson. She's a service coordinator with Central Iowa Community Services. Kathy, the pandemic is causing many changes and stresses in people's lives right now. It's causing problems with things like cash flow, loss of employment, and isolation. What are resources available to those people who might need some extra support?
Thanks for that question. It's really a good one. All of us are affected right now, certainly. People have lost jobs. With that comes, how do I pay my rent? How do I pay my utilities? How do I get food? What happens to my daycare provider? How do I get unemployment? Very practical questions. We're very lucky in Story County. We have lots of resources. That being said, how to locate them and connect to them gets to be the challenge. And I really want people to know that there is kind of a one-stop shop place for that. United Way of Story County, they've done great work. They were on this right away back in March when this started unfolding, trying to compile every possible resource there was for the kinds of practical issues people would have. They can help people locate, where do I go to get rent and assistance, emergency things? Where are the food pantries? When are they open? They can help people figure out how to do unemployment, all kinds of practical things. So if people, you can connect with them. uwstory.org is their website. They have a link that is totally devoted to COVID-19 resources, and it's fabulous. People can also just call them or call 211. They are also a local resource to help people connect with what's out there in Ames and Story County. You talked about like isolation. People are really feeling that. All of us are now. That can lead to some stress that people don't know how to handle, and they might feel they have nobody to talk to.
Well, that brings up a great point. If you have friends or family that might you might think are having a mental health crisis, what are things you should be looking for or things that should be of concern?
Well, mental health crisis is going to affect every aspect of someone's life. So practically speaking, ask people questions. How are you eating? How are you sleeping? Are you getting yourself out of bed in the morning? People are affected mentally, physically, emotionally. I think it's incumbent on all of us right now to not only be aware of ourselves, but those people we do care about, to get in touch with people, contact them, ask people questions. We want to assess to make sure people aren't really having a serious mental health crisis. This kind of situation can really cause that in folks, and especially if they're isolated. So asking people and then directing them to a resource like yourlifeiowa.org and my office, Central Iowa Community Services. During normal situation, that's what we do. We helped connect people with mental health and disability resources that are out there. So people just need to give people that info, but also realize you may need to make a call for someone. And yourlifeiowa.org, you can do that. If you have a family member or a friend you're concerned about, you can make that call. They can connect those people with the Eyerly Ball Mobile Crisis Response Team, trained professionals who will make that contact with someone and assess what people need. Sometimes people may need to talk to a trained mental health professional right away. I think more than anything, it's just important for all of us to know right now, it's okay not to feel okay. All of us are affected by this, some struggling more than others, and we really need to be aware of each other.
Thanks, Kathy. That's really great. A really important point that although we're isolated, we need to stay connected, and we really do need to look out for one another. Thank you. Our next question, actually, I think I'll kick over to Andrew Perry, who's Chief Executive Officer with McFarland Clinic. The clinic has kind of been in the middle of all of this. And I think there are questions about its operating capacity and if the clinic is even open. And if it is open, is it safe to go? Andrew?
Good question. So with the onset of the pandemic in mid-March and some of the actions that were taken around the community businesses to close, we too have been making some changes. So we have traditionally always seen a lot of patients for chronic care management and for acute conditions, but one of the main things that we do is provide preventative care. And what we made the election to do in early March and then has gone until just this past week is we have been delaying those elective or preventative cases that we would normally be seeing on a regular basis. So we have started doing those this past week and are what we consider to be mostly fully open. But I think it's important that when we have gone about maintaining our business over the past few weeks, and we will continue to do this on an ongoing basis, is we have been proactively trying to identify cohorts of patients, those that maybe have upper respiratory or respiratory conditions. Some of those could be related to COVID, some of them could be flu-like symptoms, but we're trying to identify early these populations of patients, getting them to specific locations in the communities that we serve, so that those patients that are walking into our main facilities can feel confident they're coming into a facility where they're not intermingling with some of the COVID patients or patients with upper respiratory conditions. And then we are having those patients with those conditions go to specific locations where we are more geared towards treating them. We have our own staff using appropriate PPE. So they're not doffing and donning that PPE on a regular basis. They're staying in it all day and they're taking care of those patients in that manner.
So if I'm a patient of McFarland, and as you said, I mean, there is medical care that needs to happen right now, and there are risks in delaying that too much. If I go to the clinic to seek treatment, what do I expect? What am I going to physically see?
Yeah, that is an important point. We are concerned as an organization about some of the patients delaying their care. We have seen patients present way beyond where they might normally, and that has led to a more comprehensive health condition that could have been managed proactively and early on if it was done. So we do encourage patients to come into our facilities knowing that we are trying to provide that safe environment. What a patient would expect from us is, in the steps that we've taken over the past 30 to 45 days, is that we have signage at all of our entrances. We have screeners at all of our entrances that are taking temperatures, asking a series of different questions to make sure that we're doing the proactive work to identify patients that may have conditions, again, that we are trying to identify. We have made physical changes to our facilities in the sense that we have created desk shields, we have removed some furnishings to create physical distancing. We are doing everything we can to, again, when patients come into our facilities, feel like they have their own safe space and can be taken care of accordingly. We have increased our disinfection process and equipment in our exam rooms, et cetera. We have, as I mentioned earlier, opened and are operating respiratory clinics in Ames, Carroll, and Marshalltown. And this has been proven to be a very effective means for caring for these cohorts of patients and making sure that we're doing that in a proactive fashion.
The message for our viewers is simply, it's not to stay away from the clinic, it's to seek care when appropriate and to continue to seek care for ongoing medical issues that you've had in the past.
Yeah, exactly. I was going to mention that we have made sure that we've started telehealth services. So we are trying to, again, identify patients that might be at higher risk or elderly patients that would benefit from having telehealth services, but we want to make sure keep them at home and keep them in a safe environment. And then lastly, this past week, we've also began enrolling patients in a COVID-19 home monitoring program. So we have identified patients that have either tested positive or have tested that are still pending results. And we are making daily contact with these patients to make sure that they don't end up in a more critical condition, identifying any of their needs early. And if they need to be sent to the emergency room, we're identifying them early and getting them into that situation, or staying at home, self-isolating and taking care of themselves in that fashion.
Thank you. That's very helpful information. Again, people should go to the clinic if they need care. And I appreciate that input from Andrew Perry, CEO with McFarland Clinic. Our next question really is directed at Iowa State University, and our semester is coming to an end. It's eerily quiet in Ames and on campus. Chief Newton, can you tell us what you're seeing out there, and how is the university planning to move forward and ramp up operations from this point on?
Yeah, thank you. I appreciate those questions. Normally at Iowa State University, this is a time of great celebration. This weekend would be commencement, and unfortunately, things were cut short for our students, and we're trying to find a way to give them that celebration that they so deserve for the time that they spent here. But things have been quiet. It's a very different environment for us. We still do have students living on campus in some of our residence halls, a few hundred, plus we have a couple thousand that are living in our on-campus apartments. But even with that, things look very different for the whole campus. But we do still have our frontline employees here, our police officers, our student health, our dining, our residents, our facilities folks have stuck through this entire time to be here to make sure that those that are still with us are getting the services that they need. We have seen that food insecurity, as has been within the community, has been an issue here on campus and for our students, and not just our students, but our faculty and staff as well, as things have progressed. And so we're trying to think through thoughtfully how we can assist everyone in these weird, strange times, as I like to call it, that we're in right now. We are thinking about how do we ramp things back up. Ongoing work on our ramp up is underway in our emergency operations team. It's important that we stay rooted in CDC and public health guidance and the decisions that we make. And so that's been a thoughtful piece of consideration for Iowa State University throughout this. At this time, we decided to maintain the status quo for now of where we were, even though Story County is one of the 77 counties that was allowed to reopen some businesses. So we haven't made any final decisions yet on how we're going to ramp up. I do expect at the end of the week, we will come out with some guidance for our faculty and staff on what that's going to look like, and some timelines on that. But this needs careful thought and deliberation to make sure that we do this right for the community. The decision to return to campus is also integrated with our fall planning. And what does the fall look like for Iowa State University? This week, our executive committee on fall planning really launched their work and has been in depth conversations about teaching and research. And what would then happen if we were to come back and we see a spike in cases? And what would that mean for the institution, and how do we move forward? For us, we just passed a 100-day milestone in our work as the emergency operations team here at Iowa State. And that's because we had students studying abroad. And so our work started in late January of us thinking through our efforts and what we would do. And throughout this, we've been closely aligned with all of our community partners to make sure that we understand as an institution, the decisions we make will impact the entire Ames and Story County community and our healthcare community in many different ways. So we really wanted to stay focused and connected with the community. We've had these great partner meetings, which we appreciate, and they have guided our work. Kind of in closing for me, this is a community-wide effort. This takes the entire community, and we all have to be willing to take a role and play a role to make sure that we ramp back up in the most appropriate way that also meets the needs of the community.
Thank you for that information. I know it's not the end of the semester that so many students or faculty or staff wanted to see. It's been really tough. It's been tough on those of us left behind as we saw the students kind of exit our community. It's life is different here without them, and we do miss them. We do hope that they can return safely with us next semester, next fall semester.
Yeah. Absolutely. And I would encourage the community to continue to watch our COVID-19 website. We're continuously putting new information up there. I think almost every day. And so that website is really important if you want to understand what we as an institution are doing. Like this whole fall executive team, the charge is out there, what our planning assumptions, the things that we're doing are right out there. We want to be public, and we also want the community to feel involved in our efforts.
Well, that is a great segue into my final question that I'm going to throw to Fire Chief Rich Higgins. There's a lot of behind the scenes meeting and coordination that's going on, but residents don't really see it. So what is happening community-wide with different organizations? And how does that provide a framework for a community response to COVID-19?
Thanks, Susan, for the question. Yeah, there are a lot of things going on behind the scenes that people don't see. We have weekly EOC meetings. That's our Emergency Operations Center. We're meeting every other day throughout the work week. And that involves our command team that's getting together, just like Iowa State, McFarland, Mary Greeley. We all have our individual emergency operations team. Ours is a unified command made up of the city manager's office, myself, our police chief, Chuck Sykosh, as well as our HR director, Bethany Jorgensen, is a part of that team. We meet 3 times during the week, every other day. And throughout the week, we're working on our instant action plan, our IAP. And that really sets our objectives for the week. What are we going to be working on? What do we see on the horizon for the week ahead that we need to be addressing? You know, a while back, it was cloth face masks. A while back before that, it was testing. So we're always trying to stay as much ahead of this as we can, following CDC and IDPH guidelines. After that meeting, we have a EOC working group that gets together, comprised of different members from the city of Ames. And that's the group that really that's our operations, our logistics, our finance team, making sure we're taking advantage of grant opportunities, and then also our planning team that gets together. So from that meeting, we get together, they branch out. Our logistics teams, they're securing bacterial wipes, they're getting cloth face masks, they're busy. Finance is busy securing grant opportunities. Planning is always looking ahead. How do we open if we can open up? What are other communities doing? And then operations, that's our essential service employees, you know, our water plant, our power plants, police, fire, EMS. So we have a special ops meeting on the opposite days of our EOC command team meetings. That's how important that is. So every day of the week, there's a meeting going on that's focused on our response to the COVID-19. Every Thursday, we have a partners meeting that we host that involves Iowa State University and their incident command team, McFarland Clinic, Mary Greeley Medical Center. We also have Story County EOC there, their emergency management coordinator. We have Story County Public Health as a part of that meeting. We have our long-term care facilities that are a part of that meeting. So it's a great opportunity for all of our partners to come together, share what we're doing, see how we can support each other. And that's really what's benefited our community, I think, is just coming together, this one giant team. We each have our own individual teams and our own focuses. But when we come together, a lot of great ideas are happening, and that's where we can really benefit the community by collaborating and taking advantage of those opportunities to serve the entire community and just not our populace that we may be dealing with. So that's been great, and we're thankful for our partners. Appreciate all that they're doing. It's been great.
With so much communication going on, it seems very likely that any kind of challenge or obstacle might be identified early on rather than finding out about a partner struggling with something later when it's too late to send help.
Absolutely. It's given us an opportunity to stay out about 2 weeks ahead of this as much as possible. Now, things are changing daily. We see that. It's a struggle trying to keep up with what's happening. We don't know what the governor's always going to do until that 11 o'clock press conference. So sometimes we have to be reactive. But for the most part, we're trying to plan ahead. And that's a lot because of our partners, having those partnerships to know what's happening at McFarland Clinic, to know what Iowa State's looking ahead and how we can support that, how we work with each other. So it's been very collaborative. We're all using the incident command system. It's been great. So yeah, we're thankful for the partnerships that we have.
Well, thanks, Rich. I'm not sure that people are aware of so much work that's going on behind the scenes. You were mentioning to me before about documentation. A lot of this is being recorded. We talked about grants that organizations might be eligible for based on this documentation. And all this is going on and people may not realize it's happening.
Absolutely. We have a lot of people that are busy behind the scenes. You know, our finance department and our finance branch of our Emergency Operations Center, they are busy seeing the CARES Act of what's coming in for that. What opportunities do we have? How do we maximize the grant opportunities for our community so that we maybe don't use dollars that come through the CARES Act, but we use it through the Assistance to Firefighters grant to get all of our PPE needs to supply police, fire, EMS. Instead of using grant money that police has, they can use that for other resources. So we're really trying to coordinate to maximize those opportunities for grant dollars and take advantage of them the best we can for our community.
Thanks, Rich. That was a very thorough answer. Great information. I want to thank our panel of experts for being on our Ames Responds to COVID-19 show today. Kathy Johnson from Central Iowa Community Services, Andrew Perry with McFarland Clinic, Michael Newton with Iowa State University Department of Public Safety, and Rich Higgins with the Ames Fire Department. Ames Responds to COVID-19 is an opportunity for area residents to ask their COVID-19 questions. If there's something you're curious about, get a hold of us. Let us know. We'll put together a new program soon, and maybe we'll feature your question. Please call us at 515-239-5670 or email us at covid19@cityofames.org. Finally, please remember that our program is based on the most current information we have at the time. These are rapidly changing times, and every day brings new challenges and new information. Continue to check reliable sources for the latest information. And remember that the City of Ames does have COVID-19 information on our website. That's cityofames.org, COVID-19, no hyphen. And we also have links to all the other organizations that were featured today. Again, thanks for watching.